Well, good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Tuesday, July 25th, 2023. And our top story today, osteoporosis can lead to serious health consequences for both men and women. Joining me now to discuss this and a lot more, Dr. Risa Kagan is a gynecologist, clinical professor, and also an advisory member of American Bone Health. Dr. Kagan, great to see you. Thanks so much for joining us on the program this morning.
It's my pleasure.
Yeah, we're going to talk about osteoporosis, talk about bone health. And before we kind of get into what this means for men and for women, what is osteoporosis?
Osteoporosis is a metabolic bone disease. Okay, and what it happens is people's bones, which are living tissue. People don't think of bone as being living tissue. That's what I find to be interesting talking to a lot of my patients, is that it is really an organ in the body. And what happens is there's a metabolic disease that makes it very porous, holey, and frail. And it leads one for being susceptible for a fracture. And it's, extremely important, common. And the problem is that it's not like a sexy disease. It's not like people who think about heart disease and strokes and, breast cancer or cancer, but it is actually, there's more fractures from osteoporosis worldwide than heart attacks and strokes and cancer, and people just don't pay enough attention to it.
And what age range, is there an age range, and does this affect men more than women?
No, it affects women more than men because it has something to do with hormones. But one thing I say to people is the two biggest risk factors for osteoporosis is age. Age is an independent risk factor. As we age, your risk of fracture and developing this disorder increases. And genetics is another big one, which we can't modify. That's your genes. But there are many other modifiable risk factors. It is more common in women than men because of the fact that there is a definite interplay between hormones, estrogen specifically, and as women go through menopause, we've learned that even prior to that woman's final period where hormones start declining, women start losing bone mass. For men, they tend to develop this risk a little bit later. And that's why when you look at the screening guidelines, it is a bit later than for men than for women. And there's no question that it's more common in women than men, but it does exist in men as well.
And you mentioned the screening guidelines. If I am a female, how do I determine if I have this, if I am going to be suffering from it?
Well, we're very lucky now. Years and years ago, the only way people were diagnosed is if they fell and they fractured. Well, we now have a tool called a bone density. Some people, a DEXA machine, where the convention is to measure your spine and your hip. And in certain conditions, we do the forearm. And we now can predict who is at risk for fracture based on that bone density. We define osteoporosis in multiple ways, which a lot of people are not aware of. One definition for sure is a certain measurement on the bone density that gives you osteoporosis, whether you've had a fracture or not. But a lot of people do not realize that if you, over the age of 45 or 50, you trip and fall, even from standing height, it's called a fragility fracture. The streets that you live on, you fall and break your wrist, break your ankle, break your hip, break your pelvis. Even with a bone density that may not be in the category of osteoporosis by definition, that is called a clinical fracture. And I think this is a big message to get out there to the public, men and women. because people come in all the time, someone comes in my office, 70, 75-year-old woman, look, my bone density, it doesn't look that bad. It's not in the osteoporosis range. It's in the, what we call osteopenia or low bone mass range, but she just fell and fractured her pelvis. That is a definition of osteoporosis. And she needs to pay attention to that, be evaluated and be treated, because she is at risk for future fractures, especially in that first year of having had a fracture.
Dr. Kagan, I want to talk about treatment in the second segment, but just going back to this test, is this something that if you have insurance or you're on Medicare, that it would cover this DEXA scan so that you can determine whether or not you have osteoporosis?
Yes, for sure. All women over the age of 65, every guideline Medicare will say should have a bone density test to decide, to assess whether you have low bone mass, which is called osteopenia, but with other risk factors that may make you into a high risk factor where we say you really have maybe clinical osteoporosis as well, or you do have osteoporosis. So over 65 for women and over 70 for men, plus younger men and women if they have other risk factors. So a woman comes in at 55 and she just tripped and fell and broke her humerus, her arm or her leg, she should have an evaluation and a bone density because she may have osteoporosis. It's not like it doesn't exist in younger women and men. So for instance, someone else on a high-risk medication, there are a list of medications like steroids and many medications we use for cancer treatments that make people at risk. So those people should have a bone density prior to the age of 65 or 70.
Dr. Kagan, I need to take a very quick break. When we come back, I want to talk about treatment. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network. Well, Dr. Kagan, thank you so much for sticking with us. Really appreciate you hanging around for segment number 2 this morning.
My pleasure.
Yeah, this is
educating. I love educating, really, men and women.
Yeah, this is really important. And we were talking in between the commercial break. There's really, for those youngsters out there who are still growing and developing, they're working out, take note. This is really important because your bone bank, and using your terms, we're going to talk about this in a second, it's all built on your adolescent through your early 20s.
I'm telling you, I tell every single woman I see or grandmother that I see, pay attention to your kids because sure, we have genetics, but what happens with bone, and this is living tissue, we are building bone. We are in a phase of building bone to what we call your peak bone mass. till about the age of 25 to 30. Once you get there, you got it. That's what your baseline is. And then you've got to maintain that through your young adult reproductive years. And then just prior going through perimenopause and menopause, women start losing rapidly. Some women can lose 10, 20% of their bone mass in the first few years of that, their menses or their menopause. For men, it tends to go slower later. And then all men and women have what we call age-related bone loss. So for young people who are building bone, being active is extremely important. Having a good diet rich in calcium and getting a little bit of sunshine or taking extra vitamin D, okay? The biggest problem with adolescents and young adults is smoking, alcohol, and all of those other risk factors that can interfere, staying indoors and playing video games, not getting out and exercising. All of those things have an effect on your bone bank. That's the most bank, your peak bone mass you want to achieve that you genetically can get by age 25 or 30 to give you the strongest bones, because that's what you have for the rest of your life. And you want to minimize your risk for developing fractures later in life.
Let me ask you about treatment. Can you reverse osteoporosis or help stave it off? How do you treat someone who comes, they bring their DEXA scan to you, they have osteoporosis or at least are showing signs of it?
That's correct. Well, first, let me just say our biggest goal here is to prevent fractures, okay? And we know there's a correlation between bone density on that DEXA machine and fracture risk. But that's not the whole picture. The whole picture really is you have your bone strength, which made up of bone density from that test, and then bone quality. And we can't really measure bone quality that well, but we do have other factors that go into that bone quality. And as I said, no matter how good your bone density, as you get older, that quality gets worse. And that's why it gets porous and gets more at risk for fracture. So when you have a diagnosis, for sure, one can prevent spine fractures and hip fractures by going on medication. Okay, beyond medication, and medication, what does medication do? And the biggest class of medication is to stop the turnover of bone, the loss of bone, and maintain the bone density that you've achieved. And it works on the bone quality so you don't fracture the hip and spine if you fall, and the forearm, for instance. So the medications, there is a big class of medications. The most common is called the bisphosphonate meds. They basically, the brand names are Fosamax, Actonil. We now use generic names for these. They are shown in huge studies to prevent fractures of the hip and the spine. So people should definitely, be evaluated with lab tests, look for other reasons for bone loss. But beyond, that's the most commonly used. Thereafter, for certain high-risk people, we do have some other agents. One is called Prolia. It's a shot twice a year, working in a different way on bone. For women who are younger, some women choose to be on estrogen to prevent fractures and to also prevent further bone loss. And for women also, we do have a number of agents called osteoanabolic agents. And what they are is they actually work on building bone. And these are women and men who are fracturing of multiple vertebral fractures. You just sit down and you have a fracture. We use those agents like, Timlos and Forteo, and there's a new one out now also that is out on the market that you use just for 1 year or 2 years. Then you have to maintain what you built by going on one of the other agents to prevent the loss. So there are many, many good therapies out there, but whether you go on drugs, the only way that all of this is going to work is for you to keep active, to basically fall prevention. A lot of people say, I'm going to exercise, that's how I'm going to cure my osteoporosis. That's not true at all. Once you got osteoporosis, you're not going to really reverse that osteoporosis risk. You're always at risk with that diagnosis. But what you need to do is strengthening. It's really important for you to do exercises that are going to work on balance, because as we get older, we trip, we fall. You need to be able to stand on one leg. I'll tell you what I tell my patients to do. Stand in the mirror while you're brushing your teeth at night on one leg, and you have a counter there. Let go of the counter gradually so you can balance, and you figure out how to catch yourself if you trip so you don't fall. Fall prevention is enormously important as people age, because women and men become frail. And frailty is related to muscle and muscle mass. And one of the things we've learned about, besides nutrition, making sure enough calcium, get enough vitamin D, sure, we need all those things. But if you have osteoporosis, you do need medication to prevent fractures. And, I think that message is very important. We have really good medications to prevent fractures. So a lot of people I know are reluctant to take medicines, but I think one thing I want to leave you with is that if you have a hip fracture, okay, I mean, we say that 1 in 2 women in the United States over age 50 are going to have an osteoporotic fracture, and about 1 in 4 men in the United States, okay? If you have a hip fracture, as you age, that's more common than anything. I can tell you that about 24% of people die within a year of that hip fracture. And about 20% of those people never return to full mobility in their life. So, I think this is really something to pay attention to and not to minimize. And we need to have greater awareness. That's what's really, you really need to be aware of this condition, this disease, this disorder, just like many of the other diseases that people are afraid of or are aware of.
Yeah, absolutely. Well, Dr. Kagan, I can't thank you enough for coming on the program. Really appreciate you joining us, and we look forward to having you back again very soon.
My pleasure. Thank you.
That wraps up this episode of BRN AM. Have a topic of interest, somebody you think we should talk to, drop us a line. And don't forget, for all the latest security news and lifestyle, wellness, finance, tech, so much more in all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content, then visit our website, and of course, all of our streaming partners. We're back again tomorrow for another edition of BRN AM. We'll have a very special guest. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
But if you're tired of the same
Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.